You can minimize the chances of getting a periprosthetic joint infection by optimizing patients and taking several steps ahead of time. And that's what we do here at Ohio State University. We have a medical team that's going to look the patient over. Patients that have diabetes, we like to get their hemoglobin A1C to 7 or below. We look at their body mass index, and we like to get the BMI down to 40 or below. Once you get above 35, the rates of infection start to go up, and they drastically go up when the BMI is above 40. We're going to look at a lot of other diseases that are present in many of our patients, things like renal and liver disease, and we want to make sure that we are optimizing their liver and their renal health also. We get dental clearance. We have patients see their dentist and make sure that there's not any addressable issues prior to surgery. We look at their smoking status. Smoking doubles the risk of infections, and we would like all patients to be tobacco-free 4 weeks before surgery and 4 weeks after surgery. So there's many steps that you can take to help minimize those things prior to surgery. And keeping the wound clean, making sure that your animals are not anywhere near that wound after surgery. The aftercare is just as important as well.